tonight's speaker, Angie Wallace. Angie has been a clinical hygienist for over 30 years and has been using lasers for over 20 of those. She's a member of the Academy of Laser Dentistry, where she obtained her advanced level proficiency, her educator status, and received her ALD recognized course provider certificate in 2007. She also has her mastership with ALD, which she achieved in 2008. Angie is also, for those that you know, BioLay's hygiene faculty, proud member of our faculty. We're happy to have her there as well. And she's currently serving as chair for the ALD Education Committee, co-chair for regulatory affairs, and serves on other committees for the ALD Board of Directors. Very busy with that organization. She was the recipient of the 2014 John Suleski, I hope I'm saying that correctly, Distinguished Service Award from the ALD. Angie's been recognized as a worldwide speaker teaching laser courses. I know she does plenty for us, webinars, and she also works with several laser manufacturers, making sure that their lasers are great and certainly appropriate for hygienists. She's also an in-office laser consultant, providing laser certification and training courses. She has several articles and chapters published about lasers and has co-authored her own book. So when we say she wrote the book, we're actually being very literal with that, about laser hygiene. She's very busy in clinical practice and certainly loves spending time with her family in Oklahoma as well. So with that being said, I'd like to warmly welcome tonight's speaker, Angie Wallace. Angie, take it away.
Thank you so much, David. I appreciate it. What a great introduction. I'm excited to speak with everybody tonight. So thank you for taking a little bit of time of your evening to be able to spend with me, to be able to go through what we see as lasers. So I am excited to get this started for you. So what it takes for the presentation, we're just going to go ahead and skip to the next slide here and look at the thank you. I just want to thank BioLay for sponsoring this presentation. Also, a disclosure, this presentation is a combination of some of my slides, some slides for the Academy of Laser Dentistry, as well as some videos from one of my colleagues, Lynn Atkinson, who also does a lot with BioLay. The objectives of tonight are listed here. I just want to make sure that you understand what lasers can do for you in your practice. I want to make sure that you know what the usage is of them, the fundamentals of lasers, how we can produce the characteristics of the lasers, the delivery systems, and how the emission modes work. I also want to make sure that you understand how the laser works on the tissue. So many people are so quick to just pick up a laser and start using it without understanding what the chromophore is. We have to make sure that our laser gives us the opportunity to have a chromophore that's in place so that we can do what we need to do with the lasers. With that being said, we're going to continue on. So I wanted to talk about first with laser safety. That is of utmost importance. Without the lasers, we aren't going to be able to work with what we need to do to make sure that they're done safely. I think I lost the video there for a second. Safety is where we're going to start with tonight. So with the laser safety, we just want to look through the information. David, are you on there?
Yeah, we're having some audio difficulty here, lagging a bit, Angie. So I've turned your video. Yeah, I've turned your video off just because it frees up a little bit of bandwidth. Let's see if hopefully it's momentary. I'll just leave your video off until we know your audio is coming through strongly, and then I'll turn you back on, okay?
Okay, so I should just continue with what I'm speaking with and let you go from there?
Yes, ma'am.
All right, so we'll go ahead and go on with lasers. Okay, all right, we're going to continue on with laser safety. And with laser safety, out of everything that we learn, this is probably the most important because we want to make sure that we understand how lasers work to be able to lasers. And you're going to notice this by the back of your laser will have a box on it that will indicate what type of laser it is. It will show you the wavelength of the laser. They can also create hazard to eyes as well as skin, and they can catch things on fire. They also generate air contaminants, which is why you need to use high volume evacuation. And you should also have an LSO, which is a laser safety officer in the laboratory. You should also be posting a proper warning sign. When you're using we have a proper warning sign posted. This is to indicate to people around you that lasers are being used in your operatory. So they are not walking in the operatory without their correct wavelength specific laser safety glasses. These signs should only be posted when you're actually using the lasers and not being left out time and start to ignore. With the laser safety, we need to make sure that we have a hazard zone, which is going to be the room and the surroundings protected. You will find that information in your owner's manual of your
Hey, Angie.
laser. You will also need to know what those information. Yes, sir.
Yeah, you're breaking up pretty badly, and we're only getting about every third or fourth word. So why don't we just hang on for 15 or 20 seconds and let's see if somehow the connection on your end improves. I'm not getting complaints about the other audio and video, so I do think it's on your end, unfortunately. So let's just give it maybe 30 seconds and see if it improves. If it doesn't, then we'll go to plan B, but we'll leave it at that for a moment. But I think we're getting enough of it. I just don't want to go too much further into your presentation with the audience not hearing all of it. Okay.
Okay,
So,
let me check real quick to see if I can change anything on my end. So give me
Sure.
that 30 seconds.
Sure, no problem. Please stand by, everyone. We'll be right back to you.
Does that seem to be any better, David?
Unfortunately, no, Angie. Why don't you try for a slide or two and let's see if that improves. Otherwise, we might be able to have you join by phone. That might be a clearer connection. We'll still be able to see your presentation and just have your audio by phone. But why don't you try for a slide or two and see if it's intelligible for everyone. There's quite a bit of complaints that we can't hear you or understand you. Okay.
Okay, so I'll go ahead and go on with this. The nominal ocular hazard zone is going to be the room around you. So if you have a 6-foot clearance with the laser, then you want to make sure that you have protection around those areas to make sure that you're wearing those wavelength specific safety glasses. Other standard organizations and national regulatory requirements, we need to make sure that we understand the CDRH rules, the ANSI rules, the OSHA rules, as well as other national bodies. Laser safety officer should be in place, as we discussed, as well as other laser safety mechanisms. We want to make sure that we understand how to have adverse effects reporting so that if we have something that doesn't go right with our laser, we make sure that we take care of that. We also want to make sure that we have the correct amount of training. Training is going to be something that's very important. We also want to make sure that we have our eye and tissue protection by wearing the wavelength specific safety glasses, as well as what we've already discussed about posting your proper warning signs, keeping a very controlled area, having limited access into the operatory, and make sure that we don't have any reflective surfaces and make sure that those are minimized. One of the things that's very important to have is high volume evacuation. With high volume evacuation, that is removing the plume of toxins that are generated with the laser. So that is something that's very important to make sure that we have that in place. That way, if there are anything around the area that we want to make sure that we are evaporating, we can do that with high volume evacuation. And most important is laser use for documentation. We need to make sure that we document in our charts what we're doing with our laser. Remember, if it's not documented in the chart, it doesn't exist. One of the things with eye protection is that you always want to make sure you're using the appropriate glasses for the wavelength specifics for the glasses that you're using with the correct laser. So there's different things that you want to take into consideration, but one of them is to make sure that you know what the wavelength of your glasses are. With a BioLase laser, we have a couple of options. We could be using a 980 laser as our Hygiene Epic laser is, or we could be using our 940 wavelength, which is going to be from our Epic laser and Epic X laser. So we want to make sure that our correct wavelength specific glasses fall into the category with the lasers that we have and that what we're using. Other things would be the corneal damage of the eye. Make sure that if we're using our BioLase lasers, which are the erbium chromium YSGG, that we have the correct glasses on to make sure that we're protected there. We also know that if we are working with some of our diode lasers, we need to make sure that we have protection against the lens of our eyes. And also with the water solution of our eye, we want to make sure that we have protection against that, such as our water-lase laser, to make sure that we have the correct glasses on for that as well. And of course, when we're using our diode lasers, we are attracted to dark pigmentation. And so the retinal damage part of our eye is something we need to be very cautious of, since diodes are attracted to dark pigmentation. As I mentioned earlier, we need to make sure that we're using high volume evacuation. This is going to help cool the site, as well as to remove the plume of toxins, especially the viruses and bacteria that we have in place. So when we were talking about laser documentation, our chart notes should include what the fiber size and spot size of the laser is, as well as what emission mode we're using. Did we use our laser in continuous wave or pulsed mode? What are the energy and power settings that we're using? And make sure that we document the time of exposure that we had. If we were using the laser for 10 minutes, then we're going to put our laser that we used it for 10 minutes on our chart notes. But most important is to document that we did eye protection and that we had that in place on everybody. So it would be the clinician, an assistant if they're in the room, and also for the patient or anybody else that's entered the room. Other advantages of lasers for soft tissue therapy is to know that the laser is very precise. Bacterial reduction in the sulcus is excellent. Coagulation of the treatment site is superior, and that the laser can be used on everybody regardless of age. That's very important. I always say from the 2-year-old I have to help into the chair to the 92-year-old I have to help out of the chair. We can use a laser on anyone. There are no allergic reactions to the laser, so we don't have to worry about a patient telling us that they can't have a laser used on them for any certain situation, since the laser is light. It is energy that is produced with light, so it's something that we can use on everybody. With some studies that show what diode bacterial properties are, there are several listed here to show that studies have been in place for quite some time. Even though lasers may be new to some people, we know that there are studies that have been in place for quite a few years. One of my favorite ones is the Merit study from 2005, which shows up to 90 days reduction of colony forming units. So this is something that is very important because in that 3-month intervention, that's going to be an area that we can go back when we have our patients on 3-month recalls to be able to know that in that 90-day reduction, that it's going to help really reduce that bacteria until we bring them back in again. So that's something that's very important. So how do lasers help? Lasers are going to help promote wound healing. By putting those photons into a periodontal pocket, energy is going to be collected into the mitochondria. That is the powerhouse of our cells. That's giving the body a chance to heal itself, which is extremely important because, as you know, we want to make sure that the body is healing itself as opposed to using a bunch of chemicals and other products. This is taking the place of that. Laser energy also will allow fibroblasts to help create attachments so we can get our tissue attachments, to be able to have collagen to help hold the tissue tight, and even have the opportunity for bone to be regrown over a period of time. That wouldn't be something I would guarantee to my patient, but in using lasers for quite some time, you will be amazed on what you see. So take x-rays, take documentations and photos so that you can see what takes place over time about what you're seeing with the bone that is changing in front of your eyes with the patient. Those are amazing tools that you can use for not only your patient, but also for any type of marketing to show what the laser can do in the hands of a hygienist or in the hands of a doctor. These are clinical applications for dental hygiene. Please keep in mind that you're going to want to make sure you check your State Practice Act or your province to make sure that you're within your scope of practice. But these are the things that are listed as far as what we can use lasers for in dental hygiene. So aphthous ulcers or hepatic lesions. We can do it for photobiomodulation where externally or internally, depending on how we're using our laser. Remember, that could be even just taking the tip off of the laser and using the handle so it's not focusing the light onto the tip, but actually allowing it to expand over a surface. So if you have the Hygiene Epic, you can be able to use it with just the handle, or if you have the Epic X or the Epic 10, you can use it just with the handle that you can purchase for photobiomodulation. We can also use it for tooth desensitizing, as well as laser whitening. We can do it for LBR, for laser bacterial reduction. And for most of you, you're probably most known for using it for LAPT, so laser assisted periodontal therapy, when we're going into the base of the pocket. So if you have deeper pockets, we're using our laser in conjunction with some of the other tools, such as hand instrumentations or ultrasonics. And then, of course, we can use it for hemostasis as well. So as we go through these, I'm going to show a few videos, and the first one is going to be showing you how to prepare your laser fiber, just getting it ready out of the package and what we're doing.
With the BioLase laser tips, they will also come with disposable tips that you take out of the package with the tips that you need. Once again, you can create the curve of your fiber depending on the angulation that you want. When you're placing the tip on, instead of turning the fiber piece, turn the handle and rotate it into place, locking that fiber into place. Just when you think you have it tight enough, I want you to take it and turn it just a little bit more. Once again, you can use a curved handled instrument to be able to create the curve on the fiber for the diameter that you want to change it. You also are going to follow the same protocol of placing that fiber into the sulcus. You will be doing up and down movements, and of course, when your laser is activated, you would see the red tip. But you're going to do up and down movements as well as some back and forth movements. So you're creating both your vertical movements and your horizontal movements into that pocket. Remember that we want to go really slow in those areas and that we do not want to move too fast or we can break off the tip of our fiber.
So as that was showing, was just getting the laser fiber ready to go so that we can be in the pocket for when we're using it for periodontal therapy. So we're going to talk a little bit more about what we can do with that. So laser assisted periodontal therapy, or on our Epic Hygiene laser, we're going to look at the pocket debridement or curettage settings, known as LAPT, as we discussed. This is going to help us profoundly decontaminate the periodontal pocket. The reasons that we're going to provide the LAPT is to be able to reduce that bacteria within the pocket so that we can promote growth and allow those tissues an opportunity to get new tissue attachments to heal. So I'm going to show you a video that gives us a little bit more clarity on what we would be doing with our hygiene laser.
Chose to do periodontal debridement or working into the depths of the pockets. We would be using this on a periodontal patient. Whether we are doing it with SRP and using lasers in conjunction with that, or as I prefer to call it, periodontal therapy, or if you were using this for perio maintenance, these would be the settings that you would use. I would choose my perio debridement code of 2 or curettage of 3. You will notice on your laser that both of those settings are the exact same, depending from state to state what you're allowed to call it and what you're doing with your procedure. I'm going to press into perio debridement, and once again, it's going to give me a suggested setting. You always have to read the tissue to determine how healthy that tissue is, how much infection is present, maybe the skin tones of your patient, and be able to choose the power source of what you want. You will notice that I will choose to put this maybe in continuous wave and pressing my green check mark, and maybe I feel that 0.8 watts of power are too high for this procedure. I would then choose to go down, and I feel that a good starting point for this procedure is about 0.5 watts of power. At this point, you can read the tissue and indicate whether you are getting into the pocket and destroying any bacteria or eliminating any pocket depths in those areas by going into those areas with the laser. Remember, you're going to go into the depth of the pocket and you're going to make small movements to do this procedure. Once I've got everything selected on the laser the way that I want it, once again, I have to press this button to place the laser in ready mode to be able to do the procedure that I want. When my red light is on, I'm going to then place it into an area where there is a periodontal pocket. I will always place the laser to the gum tissue, not against the tooth. Once I place it into the pocket, I will go into the depth that I have measured with my periodontal probe. I'm going to work in very small increments and I'm going to make very small movements of up and down. Notice that my light is shining bright red, but on the video it is white. That is my red aiming beam that you're seeing. I'm going to do very small movements of up and down, walking along that area of concern. Notice that I don't want to do way fast movements because I'm going to get really sloppy with my laser, and I'm going to be able to skip over areas as well as not be able to let the laser interact with the tissue. Once again, small movements up and down. I prefer to call them as a cross-hatching motion. And once you indicate where the depth of the pocket changes, you're going to make small movements back and forth in horizontal movements as well. So that cross-hatching motion will catch it here, or if you miss something in your up and down movements, you can go back and forth and catch it there. So you would go to the depth of the pocket and almost all the way out. And then when you're doing back and forth movements, you can start at the base of the pocket and move your way up, or you can start at the gingival crest and move your way down into the pocket, whichever you prefer. Periodically, you're going to come out of the sulcus and you're going to wipe off the tip with a 2x2 piece of gauze to remove any coagulum that has adhered to the end of that fiber. If you leave that on there, it's going to get very warm and it's going to allow that patient to be uncomfortable with your laser energy. Now, if you're in that pocket and you are not getting the tissue interaction that you're wanting, that would give you the opportunity to turn your laser up. I usually only go up a little bit at a time, and once again, go back into those pockets. If at this point that is the setting that works and I'm starting to see some tissue change on there without getting too hot and potentially cutting the tissue, I would then use my laser at that procedure for the rest of the areas. Once again, remember to keep it towards the tissue, never towards the tooth, and always make sure that you're doing those up and down and back and forth movements to be able to get into those periodontal pockets and decontaminate the bacteria at the base of the pocket and within the periodontal walls. Once you have completely worked on the areas of concern, whether you were working with an SRP patient and doing a quadrant or a sextant, or if you were doing periodontal maintenance and going over the mouth with the existing pockets that were still remaining, once you finish that procedure, you would simply place your laser in standby mode again, go back to your home page, and turn your laser off.
So that gives you a little bit of an example, and it's easier to watch on a video. And of course, it would be nice to be able to have a hands-on opportunity as well, which we have other courses that you can participate in that to be able to have a little bit more time to work with it and have one of us kind of observing you. So there are those opportunities as well. But this just gives you kind of a general synopsis as far as what we're doing with the laser when we're doing it for LAPT. The next thing we're going to talk about is LBR. That's laser bacterial reduction. We have that listed as pocket therapy on our lasers so that you understand what each one of those mean. This is almost like a pre-procedural rinse. So this is not taking the laser into the base of the pocket, but simply going about a 0.5 millimeter to 1 millimeter into the sulcus where we are decontaminating those areas without a high power amount of energy. This is just enough to, as I said, use as a pre-procedural rinse. So we can do this on a prophy patient or a perio patient, but only being placed a 0.5 millimeter to 1 millimeter into the sulcus. This is going to really help us reduce bacteria, reduce cross-contamination, and help us to prevent attachment loss. So by using it on a prophy, we can hopefully keep our tissues healthy enough that they won't lead into any type of gum issues or concerns. We're going to look at a video that will show you how LBR takes place.
To provide pocket therapy, or LBR, is when we're going to reduce the bacteria in the mouth. This is not going into deep periodontal pockets. This is simply going around the mouth, similar to a pre-procedural rinse, just as we've shown you in our slides earlier. You're going to choose the selection of pocket therapy. Once you place that, it's going to give you a suggested setting. Remember that you can increase or decrease this dependent on your patient's tissue type. I typically am going to use this a little bit lower in either a 0.3 or a 0.4 setting. You can use it in the 10% cycle if you choose to do so, or you can change that if you want a little bit more energy. Maybe for this procedure, you choose to put it at 50% on and 50% off. Once you've made those selections based on your patient and their tissue type, you're going to press the green arrow and have it in a standby mode ready to go. Remember to activate your laser and to turn it on, you have to press this button, which allows the green lights to come on. In a procedure such as pocket therapy or LBR, we are going to be simply placing the laser fiber onto the gum tissue and slightly a half a millimeter or a millimeter underneath the gum tissue, and just move it in little nodes to be able to get the laser energy underneath that gum tissue. At this point, you're not going to see any tissue interaction. Nothing is going to be happening to the patient's tissue because you are not going to be removing anything. You are just reducing the bacteria. If the patient has a lot of inflammation, you may see that the gums bleed during this procedure. It's simply okay because that laser energy, even a red aiming beam, will provide a therapeutic benefit, allowing it to heal and protect the gums. So once again, you're going to use it in a scooping or sweeping motion into the gum tissue, a half a millimeter or a millimeter in. Notice that I have the tip pointed towards the gum tissue, not pointed against the tube. By doing that, you're going to create that scooping motion around your gums. You will see in the video that my red aiming beam appears to be white, but the red aiming beam is an indication to show us where that laser is pointed. Notice that you do not hear any sounds of the laser working, as I am not pressing on the foot pedal to actually place energy into this gum tissue. Once you have went around the entire dentition from the outside and the inside, on the upper and the lower, LVR procedures would be completed. At this point, you would then continue on with the rest of your procedures, whether it's for a prophy or for periodontal treatment. Once again, this is LVR, so we are not going into the depth of the pockets. We are simply putting energy into the tissue as pocket reduction as a pre-procedural rinse. Once you're finished with your procedure, you're simply going to place this in standby mode again. If you're finished using your laser, you would go back to the home page and be able to turn your laser off on the switch on the back of the machine.
So all of that looks very easy, and it is something that is a very easy skill to achieve. It just does take a little bit of practice. So you always want to make sure that you have the opportunity to practice. One of my favorite things to use on practice mode would be a piece of beef stew meat and maybe get some extracted teeth and work on those areas. The reason I use beef stew meat as opposed to hot dogs or anything else is the chromophore. Remember, these lasers are attracted to dark pigmentation. And so we need something that is going to be similar to what our gingival tissue is. Otherwise, we would have to increase the setting so high to get any type of tissue interaction that it would be very unfamiliar for us on Monday morning, because our settings would be different on a real patient than they would be on a hot dog. So the beef stew meat, in my opinion, seems to work really well. Other times we use pig jaws, which is also a great way to practice. So that might be something that you want to get so that you can work on with your laser and make sure that you feel comfortable with it. Also, when you're using your laser, you always want to make sure that you're using your high volume evacuation, as we discussed earlier. That, once again, is going to be helping us to remove the plume of toxins or anything that's in concern of the air, so that we make sure that we're using that laser safely and not inhaling any type of toxins. So both of those procedures, you always want to use high volume evacuation as well. If we continue on, the next topic is going to be aphthous ulcers and hepatic lesions. Out of everything that I do with my laser, I have to say that this is one of my favorite procedures. This is a huge practice builder. If you can get your patient to come in and work on a hepatic lesion that has been painful for them, and they're not very appearance-wise, they're not very appealing, your patient wants to do something to get those taken care of. So one way or the other, you want to make sure that you find a way to treat these areas to make the patient comfortable. With this, you would be using your laser in non-contact mode, meaning that you're not touching the lesion with your laser. You're going to be approximately 2 millimeters away from the areas of concern. You're going to be using a non-initiated tip. For those of you that don't know what that means, a non-initiated tip allows more energy to kind of pass over a larger area. An initiated tip means that we've touched it on something dark, maybe articulating paper, or placed ink at the end of it, or purchased tips that are already pre-initiated. We would use the non-initiated tip because we want the area to be covered over a larger surface area. I typically will use my laser in continuous wave for hepatic lesions and aphthous ulcers because I want that energy to spread over those areas. I would place my laser about 2 millimeters away from the lesion. So I'm going to be hovering above it. I'm going to start at a very low setting, about 0.3 watts of power. That is going to allow me the opportunity to start low to make sure that it's comfortable for the patient, but at the same time, be able to get that laser energy in those areas. I show that it's going to be about 45 to 60 seconds per setting. And the settings that I use are starting at 0.3, then I go on to 0.5, then I go to 0.7, 0.9, and I finish at 1 watt of power. I usually don't time how long it takes me to go around those settings. It's going to be more about how large that surface area is and how long it takes me to go over those areas. I am going to laser those in that same cross-hatching motion that I was discussing in the video, but instead of being down into the pocket, I'm going to be over the surface of those areas in that cross-hatching mode. When I finish all 5 settings, and I do those just one right after the other, I will allow my patient to have vitamin E placed on it so that it kind of soothes that area and protects that area. So we'll talk about that in the video. This is just showing what the lesion looks like. Excuse me. You can see in this particular area for an aphthous ulcer that the lesion is white, but you can see the redness around it. And that area is also an area that's very painful for the patient. So with that being said, you want to usually laser that area as well. I always tell everybody to go 1 millimeter past the visible borders of what they see on those lesions. So I would go past 1 millimeter past the redness that I see on this particular picture.
If I was using this laser to do an aphthous ulcer or hepatic lesion, I have a couple of options. The settings are still the same between aphthous ulcer, where I can use this down arrow to go to our next list of procedures. Notice that we can also do hemostasis with our laser, and we can customize the settings that we choose by placing 7 or 8 as those procedures of choice that we use frequently. Once again, I can choose 4 or 5 for hepatic lesion. They are the same setups, so either way, your settings will be the same. Notice that we have this in continuous wave, which I would agree with because I want as much of the laser energy going into the area of concern as possible. I usually start with my laser down at 0.3 watts of power, as I showed you on the slides earlier in our presentation. Once you get it to the place that you want, you have to press this button again to make sure that the green light comes on, indicated by our red aiming beam you see on the end of the fiber. I'm going to show you this as an aphthous ulcer on this model, but the procedure would be the same whether it was a hepatic lesion or an aphthous ulcer. I've identified a hepatic lesion or aphthous ulcer on this model just by drawing a line on the gingiva. I would start by placing my laser about 1 millimeter outside of the normal borders of what I see that are concerning me. I would slowly turn on my laser and go slowly around the outside of the edge of that lesion. I would make 2 passes around that. It's kind of almost like outlining our area of treatment. Once I've done that, I'm going to go back and forth, and I'm going to go over those areas of concern, slowly going all the way across the lesion. We're going to go ahead and go back and forth as we completely laser that lesion, and then we're going to do perpendicular movements and do our horizontal movements. So we would do vertical and horizontal movements just like we did in a periodontal pocket, with the exception of us going about 2 millimeters above the surface of this hepatic lesion. Once we completely laser it at this particular setting, I always turn my laser up and go to 0.5. Once again, you'll see if you're changing it, it stays in ready mode if you're just making simple adjustments as that. I would do the very same procedure again, where I would be outlining it about 2 millimeters away from the tissue and about 1 millimeter outside of what I visibly can see as that lesion. Once I've done that, I'm going to go back and forth and go over those areas again and be able to laser all the way across to those lesions. Once I received and reached the areas of concern, I would do my back and forth movements. So I would change that and go up and down across those areas. After I completed this procedure at 0.5, just as I showed you in the slides earlier, I would complete at 0.7. I would then go to 0.9 and finish at 1 watt of power. After all 5 settings, I would finish this laser procedure by placing vitamin E on the lesions. Remember, if you have multiple lesions that you're treating, you would do all of them at 0.3, then go all of them to 0.5 settings, and then your 0.7, your 0.9, and your 1 watt of power. Remember, at 2 millimeters away from that area, you have less energy than 1 watt, so you don't have to worry about cutting the tissue. After I complete that procedure, I would place vitamin E on all the lesions that I treated. Remember, if it is something of a herpetic lesion, I would use different fingers to place a vitamin E on those areas. Once I complete my procedure, I would then once again place my laser mode into standby mode, and I would be ready to complete my procedure for herpetic lesions or aphthous ulcers.
Okay, so as we were talking in this video, these settings that I shared with you are settings that I made up several years ago when I first started using lasers. Lasers didn't have all these little presets on our lasers. In fact, we usually had to calculate them to get the right amount of pulsing along with the setting that we were choosing to use. So those settings that I came up with were something that worked really well for me, and I've continued to use those throughout my entire time of using lasers. You could just go into the setting that is the suggested setting with this laser and just use it at that setting. But I feel by lowering the settings allows the patient to be more comfortable with the laser. They feel warmth and it's not too hot at those very low settings, but you're still putting that laser energy into those tissues. By doing it on those 5 settings, it allows a patient to kind of have a second to make sure it's uncomfortable for them and make sure that it's not too uncomfortable. You could have the patient wave at you or raise their hand if it starts becoming warm. And as you increase those settings, you will notice that the patient does become a little bit more accustomed to the setting that you're using. But if it gets too hot, once again, they can just ask you to make it a little bit where it's not so much painful, but be able to go slower with it if you need to, or speed it up if it's too uncomfortable for them. Another way that makes them really comfortable is to have their high volume evacuation right next to that. A couple things are going to take place. One is, once again, you're removing those toxins and things of concern, but at the same point, you're kind of pulling cool air across those areas. And so that does make your patient much more comfortable by using that high volume evacuation, as well as a protection for you as well. So once again, you can use a few different options of the different settings, but those settings are the ones that I've used and had really great success with those. The next thing we're going to talk about is diodes and the desensitizing. This, if I was to talk about this just as one of the things of a procedure, I can't say that it would have been one of my favorite procedures that a laser can do. But once I started adding fluoride varnish into it, I feel like it really made a huge difference as far as what I could do. So once again, I'm not going to be touching the area, but I'm going to place my laser about 2 millimeters above the area that I want to desensitize. I then will place fluoride varnish and just brush a little fluoride varnish on the area that I'm going to be lasering. And I will do 30-second intervals and pretty much start from that low setting as we discussed with herpetic lesion and aphthous ulcers, and slowly work my way up to a higher setting. I do this in continuous wave as well, and I do have my high volume evacuation. If I complete this series and the patient is still uncomfortable, I will add more fluoride on those areas as needed and start my selection of choice settings over again. Typically, I can go through one whole setting and the patient will feel much more comfortable with that. And it seems to last for several months. So we'll show you a video on this.
If I was to use this laser to do desensitizing, I would find my areas of concern and I would put my laser right against the surface of it. So I want to make sure that that laser energy would be pointed right at that tooth surface. By doing that, I would then start going back and forth across those areas, starting at a very low setting and just slowly go across that area. This can be tested by placing some fluoride varnish on those areas first and allowing this laser heat and energy to be able to put it into the tubules of the areas of concern. After you've completed that cycle at the lower setting, you would then place more fluoride if needed and go up to your next setting as we discussed on those slides. Once again, going back and forth on those areas. Once you have completed those series, you would then be able to test the area by either placing some air against that area or just seeing how the patient feels when they place their tongue against it. Those areas will be easily desensitized when you're using your laser.
So very easy procedure. And as I said, I think adding the fluoride varnish makes all the difference in the world as far as what I get from that. The next one we're going to talk about is hemostasis. And this is a suggested setting. Once again, you're going to have it in continuous wave and you can use it at 0.5 watts of power. So whether you have an area that just has been bleeding a lot and you just kind of want to get that under control to evaluate the areas of concern you've been working on, 0.5 watts of power seems to be a good setting for this. I'm going to show you a video, and this is by Lynn Atkinson, as I said earlier, one of our colleagues, an amazing clinician, and just show you kind of how she's using her video. There is no sound on this video, so I didn't want you to think that my sound would quit working. This is just showing you what's taking place with this video. So you can see as she's placing it around the tooth, how that's coagulating, and it's starting to stick to the end of the fiber where that is getting a little bit darker. That's because the laser is interacting with the blood, just like it's attracted to. It's a darker chromophore, so the laser sees that. And as she's stepping away from it, she's just wiping off the tip so that she can go back into those areas. So it's just creating that coagulation to take place and hemostasis. So this works out great for dentists after extractions. Instead of packing your patient full of gauze, you can just take your laser, go down into the sulcus of where the extraction took place, and get your laser working around in a circular motion to create that coagulum to form and get the hemostasis to occur. So great opportunity of how to use the laser. So as David mentioned earlier, I did write a book several years ago. I was known as Angie Mott at that point instead of Angie Wallace, but this is a book that I wrote with one of my students. So if any of you are interested in some of the soft tissue procedures, you could find the information in this book. And so that's something that you might want to take advantage of. And then the other thing is, this is my contact information. If any of you are wanting to look at doing laser certification courses or learn more about lasers, or you can just reach out to me and ask me questions if tonight all your questions are not answered, here is my contact information. I love helping people, and I love working with you to answer your questions so that you can be the best laser hygienist possible. So with that, David, I'm going to go ahead and turn it back over to you so that we can get some questions answered, because it looks like we have quite a few.
Excellent, Angie. Thank you. And I appreciate you helping us through this little AV issue. It sounds like whatever you did worked and you came through loud and clear. So it's terrific.
I do apologize for that.
You have some questions. Angie, I'm going to try and turn your camera back on. I always think it's nice for the audience to see you. So let's see if for some reason it kind of goes south and we start losing you again, we'll turn you back off. Okay. But I think to answer the questions, it's good hygiene here. Okay. So the first question, Angie, is from Heather Powell. Well, Heather says, hi, the volume is too low. So I won't have to put that to you there. All right, here we go. It's from Courtney Buenaventura. Should we use the HVE for LBR as well?
Yes, absolutely. Anytime that we're using the laser, you really want to use your HVE, just because we want to make sure that we're not letting any toxins cause any issues or concerns. So using your HVE is always very, very important.
Excellent. Anonymous attendee. So whoever you are, what tissue changes are you looking for? What should the tissue look like? And I'm sorry, Angie, I don't know which procedure they were specifically speaking to, but maybe you can try and take a swing at that one for us.
Absolutely. So for LBR, you're not going to see any tissue change at all. Remember, that's just going into the sulcus, 0.5 millimeter or 1 millimeter. You will not see any tissue interaction at all. You should not have anything coming off on the tip of your laser with LBR. On LAPT, that is where we're decontaminating. We are going into that pocket, and occasionally we're going to get coagulum to stick on the end of the fiber. And so we will see stuff coming out of that pocket. It could be dead diseased tissue that's necrotic. There can be a lot of interactions with that, maybe just with the hemostasis, with the bleeding. In that particular situation, we will see stuff changing on our laser fiber as we're exiting the pocket. You do want to make sure that you're not getting a stringy white tissue or anything that looks like it's blanching the tissue, because then your settings may be too high and you might be going from a hygiene procedure and crossing over the line and doing a dentist procedure. So you just want to read the tissue. That's a comment that you'll hear us say at BioLase quite often, is you want to read the tissue and make sure that you are interacting in your scope of practice and not going over and becoming a doctor and cutting tissue. So just looking for the coagulum to be able to be produced, or even just a fresh bleed. Sometimes when we get a fresh red bleed, we know that we're interacting with the tissue.
Excellent. That's great. Thank you so much. This is from Heather Jenkins. I went to a laser course years ago and the instructor said to do LBR at the end of the appointment. What are your thoughts on this?
Ooh, very good question. So if you talk to 15 of us laser hygienists, you would probably get 15 different answers. Some of us will use LBR at the beginning of your appointment, almost as I said, a pre-procedural rinse. Other people will use it at the end. Some people do it both. Some people do it at the beginning and then finish off with that. When you're using LBR at the end of your appointment, whether you're going into the sulcus or even just going on the outside of the tissue by pointing a laser at the tissue, you are still going to have some interaction where you're getting that laser energy to do something, whether it's starting a healing process, whether it's causing hemostasis to occur, whether it's just putting the energy in there to kind of seal everything over. All of those are applicable procedures that you can do. So there isn't really a wrong way to do it. It's just a matter of getting in there and using the laser. And both ways you will see results from.
Excellent. It's a great answer. Thanks so much. Anonymous attendee again. So if it's the same one, they're getting in two questions. Lucky them. Is it still considered LAPT after SRP when going the depth of the pocket if you're not removing soft tissue? We're not supposed to remove cut tissue here in Indiana.
Actually, as a hygienist, we're never supposed to remove tissue that is outside of our scope of practice. When you have dead, diseased, necrotic tissue into the pocket, it's free floating into the sulcular fluid. So it's collecting on the end of the laser, but our laser is not in a cutting mode. So we're not performing procedures that's going to remove tissue and especially healthy attached tissue. This is just free floating bacteria that's in those areas. And think of it at the laser as almost attracting it. It's going into that sulcus and the laser sees darkness and whatever that is attaching to the end of the fiber and you're taking it out. So I stay away from the words remove because I do think that is outside of our scope of practice. So it is in addition to SRP. I complete that procedure and use that on the tooth surface and clean off this ultrasonic with the hand instrumentations, whatever it is to do with a tooth, and then follow immediately after that procedure with the laser to decontaminate the periodontal walls. So SRP is appropriate, but that's to me, a dated term that I prefer to call the whole procedure laser assisted periodontal therapy, knowing that I'm using it in conjunction with SRP and my laser.
That's great, Angie. Thank you. So Yadria, we don't make a copy of the slides available, but we do record these presentations and make them available on biolaser.com. So you'd be able to re-watch it. So I'll answer that one for you, Angie. This is from Michelle Nevis. Hi, do you need to anesthetize for what I think she meant aphthous ulcers? It didn't type that way. Can you laser herpes labialis?
Yes, without anesthetic, because you are starting at a low setting, your patient's going to feel very comfortable. They're just going to feel warmth with that. So you will never need to anesthetize for a herpetic lesion or an aphthous ulcer. As I said, as I go through my series of settings, sometimes when I get to about 1 watt of power, it's starting to become uncomfortable for the patient. So a couple of options that you could do would be 1, move a little faster, 2, back off a little bit further away from those areas, or 3, just stop and give them a little bit of a break, keeping your high volume evacuation on there to help that coolness across the area. And then once the patient feels comfortable, just go back in and continue and complete your procedure. But no anesthetic is necessary. Topical anesthetic over herpetic lesion or aphthous ulcer while lasering is not indicated. In fact, that would almost like block that area to where the laser isn't going to have the full effects on it. So to answer the question, no anesthetic is necessary.
Perfect. Thank you. Let's see, Angie. Another anonymous attendee. Do you charge per canker sore or one code charge for each lesion?
Well, since there isn't a code for herpetic lesions and aphthous ulcers, we have made up an in-office code for ours just so we can document and keep track of those. But we charge in our office $95 for a herpetic lesion or aphthous ulcer. If the patient has multiple areas of concern, we will adjust that fee. I don't usually do 95 times 3 areas. I just kind of come up with a standard fee for that. But we will charge that area, but it's good for 1 year, meaning that if a patient gets a herpetic lesion in that area again, if it's within 1 year, we will not charge them again. So to me, that's such a huge practice builder in the fact that you pay $95, and if a herpetic lesion shows up in that area again, and we do it at no charge, people are pretty receptive to that. In fact, A lot of times people are very quick to spend $95 when they've been spending $25, $35 on tubes of things that they can place on their lip to mask it, where the laser has a direct interaction with it. So $95, make it an office code, guarantee it for a year if you choose to do so, and that works out really well.
Excellent. Thank you for that. Let's see. Carly Stratton, for desensitizing, do you place FL first? I assume fluoride. I'm sorry. Place FL first, then laser, then place more FL.
Absolutely. So I start by placing it on the area of concern, and I just put that on with a little brush. So I use a fluoride varnish, whichever one of choice is yours, and it doesn't matter which flavor. Rub that on those areas of concern. Then I start my laser settings as we discussed. You will see that fluoride on there, and if all of a sudden you can't see it on there, what that means is that fluoride is starting to kind of incorporate into the tubules of the teeth. I just reapply it as needed.
Perfect. Thank you. This is from Corey Worgan. I hope I'm saying your name correctly. Let's see. Asking if the laser helps with lesions in the corners of the mouth that are caused by fungal infections.
Absolutely. That is a really good one to know, because a lot of patients, if they do start getting that, it's so sore and it breaks open so easily. And the laser can be used on those areas just like you would a herpetic lesion or aphthous ulcer. In fact, just yesterday, I had a patient who came in, and even though Oklahoma is not that cold in the wintertime, it is still very dry, and he had split his lower lip. And since I was going to be using it for LAPT, I just used the laser on his lip as well. And I didn't even charge him for that. We were still doing our other procedure. So I went ahead and just lasered his lip, and immediately he could tell me that it felt like it had pulled that tissue tighter together, and that when he smiled, it didn't feel like it was going to split open. So you can use it on multitude of areas of concerns. If there's a lesion or trauma, toothbrush, if they jab their toothbrush in there and caused a canker sore, there's all kinds of needs for the laser.
Excellent. Thank you. Anonymous attendee, how does the laser do when varnish is applied to the area of sensitivity?
I'm not sure if I'm understanding that question, but the laser is just interacting with that. It's still going through the fluoride, so it's still working with the actual tooth surface. But because we're placing that fluoride on there, as I said, the studies are showing us that it's kind of melting it into the tubules of the teeth. And I'm going to say that very lightly and kind of quotes, because it's just forcing it into that tissue. And as I said, it's made those areas so much less sensitive for the patient that it's just been such an easy procedure to do with fabulous results.
Excellent. Let's see. How are offices in states where hygienists cannot use lasers implementing laser periodontal therapy?
Oh, that is awesome question. So even if you're in a state that you cannot use a laser, there's no reason that you can't have a laser in your operatory ready to go to where you have done all your other procedures that you're going to do, and then be able to have the doctor come in where all they have to do is put on their safety glasses, because you would already have them on you as well as your patient. You're already going to have the laser settings appropriate and be able to have it ready to go, where all they have to do is come in, push the button, and laser around the areas where they're needing to decontaminate and work on the areas of concern. So states that cannot have hygienists that are using lasers can still utilize them and have it in their office ready to go for their patients.
That's great. I'm so sorry, I was on mute accidentally. I apologize. This question I could probably answer, but Karen wanted to know about settings being the same for diodes and waterlays, and I think we kind of put that to the end, Angie. But Karen, they're completely different lasers, and the settings would not be the same. Angie, is that a fair enough answer?
It is. Sometimes our settings can be similar and close in settings, just depending what modes we're using it in, and what our overall results are trying to be achieved. So that would just look at some of the studies, look at the owner's manuals, and read through what procedure you're trying to do, because it will give you those suggested settings, and then you can incorporate those to see what works best for your patient to be able to be comfortable. Remember, we're reading the tissue, not just looking at a box on the laser that says, okay, this box says this. That's not how we're going to do it. We're going to do it by reading the tissue.
I think that's great. Thank you. Corey Morgan again, with LBR, are we stepping on the foot pedal with a non-initiated tip or not stepping on the pedal with a non-initiated tip?
Oh, that's a
Also,
great question.
are we initiating the tip prior to doing LAPT? She was wondering if she missed that part.
Okay, so as far as the first one with LBR, believe it or not, even if you don't put your foot on the foot pedal with LBR, you are still going to get some laser energy coming out just because of that red light. If you don't have your foot on the foot pedal, you're not putting the true laser energy out there. You're just getting the red light, which can still create some thermal energy and still give you a benefit. However, when we're doing LBR in the patient's mouth, we do want to put our foot on the foot pedal so that we're getting the actual laser, the diode laser to work, not just the aiming beam of the red light. So yes, you would want to put your foot on the foot pedal to get the best results. As far as interaction and activating a tip, if you're using an initiated tip, I usually don't. I know some of my colleagues will initiate the fiber going into the sulcus. I usually use an uninitiated fiber because that laser is attracted to dark pigmentation. So when you take an uninitiated tip and place it into the sulcus, it's going to interact on its own with the tissue because of the darkness in the periodontal pocket. So you have the opportunity to do one or the other. There isn't really a right or a wrong. Sometimes if you have initiated tip and you turn your laser up too high, that's going to interact and maybe start cutting tissue. So if a new laser user was using it, I would suggest that they start with an uninitiated tip, get their settings and their adjustments where they need them to be to know and read the tissue to see what's taking place. And then if down the road they want to start with initiated tip, they can, just knowing what's happening when you're doing that and maybe need to use lower settings.
Excellent answer. Thank you. We've got a couple minutes, Angie, and another dozen or 16 questions. So it's really not going to get to all of them. And I certainly apologize to anyone whose question won't get answered. Angie's offered her contact information, which is up there. This will be recorded. There's certainly via our Hygiene Academy, a ton of ways to get some support around diodes and in hygiene practice. So again, apologize in advance if we don't get to your question. There's almost 50 of them. So nice job, Angie, eliciting the questions there. Let's see. Can you do LBR on an ortho patient?
You can. The difference will be is where you angle the tip. So if you use the tip straight on, it might be able to go underneath the wire so that you have the angle that you want as opposed to curving the fiber. Sometimes when you curve the fiber and you try to lean it against the tooth, the bracket can get in the way. So you're just going to have to kind of make those adjustments and angle it so that you can reach in the areas that you want, but it won't interact with the metal of the brackets. And you're not going to be touching the tip on the brackets anyway. So the biggest challenge would just be angle it in the right areas to achieve those results.
Excellent. Let's see here. Is there any comparative evidence of you? Oh, that's a great question. Comparative evidence of using the laser versus, say, Arrestin?
That is a great question. So because the laser, as a study that I showed you, the Marit study that I told you was my favorite study, Arrestin is claiming that same 90-day, but that's placing a chemical into a periodontal pocket that all of us know is a little difficult to get it to stay in there to get the results that we want and getting it to do what we want it to do. With the laser, it's something we can pick up and just place in there. And the way that the interaction with the tissue takes place, we're getting, I don't want to say immediate results, but very quick results that we're going to start healing and start achieving what we're looking for almost immediately, as opposed to having to have the Arrestin take its time to do what it needs to do to create tissue attachments to form. The laser is going to start doing that right away because we're working with the body to interact with the tissue, not a chemical.
Excellent. And last question. Like I said, I could have gone on for another 10 or 12 of them, Angie. But the last question, do you recommend a betadine or chlorhexidine rinse following layering deep pockets? Lasering, I'm sure, deep pockets.
As far as the betadine, that would be somewhat acceptable, but I do not like to irrigate with anything after I've used my laser because I want that coagulum to have kind of where it's almost a glue, if you want to call it that the blood is causing that an issue to be able to stick together and be able to do what we need it to do. So the only thing that I put on any of my laser procedures after I'm finished would be vitamin E. And so I don't irrigate anything out because I want that fresh red bleed and that coagulum to stick everything together.
Terrific, Angie. Thanks so much.